Being deficient in certain nutrients can cause or worsen your anxiety, and getting more of the right vitamins and minerals can increase your ability to properly manage stress. Anxiety itself also depletes nutrient levels, so the more anxious you are, the faster your body will burn through its vitamins and minerals. The lower your nutrient levels, the more anxiety you have. It can become a never-ending cycle, eventually leading you to a psychiatrist's office. But instead of checking your nutrient levels, your psychiatrist is then likely to prescribe anti-anxiety medication. And what most people don't realise, including the psychiatrist, is the anti-anxiety medication can then further deplete your nutrient levels. It doesn't have to be this way. You can nip the problem in the bud by making sure you get enough vitamins and minerals through your food and supplementation, and this can make a profound difference. Magnesium is the fourth most abundant mineral in the body, and it's essential for the optimal brain function and mental health. Unfortunately, many people don't get enough magnesium, even if they eat a healthy diet. In fact, research shows many people are deficient in magnesium nowadays. This is a big problem because magnesium is necessary for the optimal neurotransmitter activity and for the proper functioning of the nervous system. Researchers have found lower magnesium levels contribute and worsen many neuropsychiatric problems, including anxiety. In one study, it was shown not getting enough magnesium significantly increases anxiety. Magnesium foods include avocados, bananas, almonds, spinach, and dark chocolate, etc. A magnesium deficiency can make you more anxious. Another study found a magnesium deficiency can increase anxiety by changing the composition of your gut bacteria. The good news is 9 different studies have concluded magnesium supplementation can reduce anxiety in humans, and it can improve anxiety-related disorders. Plenty of researchers have also found magnesium has a calming effect in animals by activating the GABA-A receptors. These are the same receptors that get activated by anti-anxiety medication. So if you have anxiety, it's important you have enough magnesium so you don't have a deficiency. Luckily, there's a number of ways to do this. You can eat plenty of magnesium-rich foods on a regular basis. Epsom salt baths are another great source of magnesium and an excellent way to increase your levels. You simply put the Epsom salts in your bathtub and take a bath at night before bed. You can take a high-quality supplement that includes magnesium to make sure you're covering all your bases. Correcting a magnesium deficiency can also help you to overcome trauma, depression, addiction, and withdrawal. Zinc is another important mineral for mental health, and you want to avoid a deficiency at all costs. Like magnesium, it supports neurotransmitter production and nervous system functioning, and research shows having a zinc deficiency can worsen your anxiety. More than one study has found individuals with anxiety have significantly lower levels of zinc. Supplementing with zinc can effectively increase the zinc levels and reduce symptoms of anxiety. Zinc-rich foods include salmon, red meat, nuts, and seeds. Studies have revealed a link between the zinc deficiency and anxiety, and when the animals are fed a zinc-deficient diet, they display increased anxiety-like behaviour. Unfortunately, researchers estimate there's about 2 billion people in the world that are deficient in zinc, and studies show even a mild deficiency impairs brain function in children and adults. If you're deficient, take a high-quality zinc supplement like OptiZinc, as this contains the necessary copper, and this helps prevent a copper deficiency that the zinc can cause. Zinc also stimulates the vagus nerve, and this reduces anxiety. The EGCG catechin from green tea and quercetin help to increase the absorption of zinc. Vitamin B6 is a key nutrient that supports your entire nervous system. It accomplishes this by playing a key role in the production of the calming neurotransmitters serotonin and GABA. So having a deficiency in B6 can definitely increase your anxiety. The B6 levels have been shown to significantly be lower in individuals who have anxiety and panic attacks. Some of the best food sources of vitamin B6 include potatoes, bananas, and chicken. If you want to see quick improvements, you want to try supplementing with vitamin B6. Studies have found B6 supplements reduce anxiety. Psychiatric medication can actually further deplete your B6, increasing anxiety in the long run. If you take a medication to manage anxiety, or simply have anxiety and want to manage it better, it's recommended you supplement with B6. The nootropic compound amoxicillin, also known as Mexidol, is an antioxidant manufactured in Russia. Its chemical structure resembles pyridoxine, a type of vitamin B6. One study concluded the Mexidol exerted a positive effect on affective sphere, normalized the sleep-wake cycle, promoted rehabilitation of cognitive function, thus improving the global clinical state of patients. Marked and significant improvements were found in 40% and 33% of the cases respectively, and no severe side effects were noticed. Omega-3 fatty acids are essential fats, meaning your body can't produce them. They're necessary for the normal functioning of your brain and the nervous system, so not surprising, not eating enough omega-3 can increase anxiety. Researchers have found low levels of omega-3 fatty acids in anxious individuals. Salmon, avocados, olive oil, nuts and seeds are rich in omega-3s. People with the lowest levels of omega-3 tend to have the most severe anxiety. Omega-3 fatty acids are found primarily in cold water fish. Unfortunately, most people don't consume enough, therefore supplementation is usually necessary. Numerous studies show supplementing with the fish oil can lower inflammation and reduce the symptoms of anxiety. Other than reducing anxiety, the omega-3 has been shown to stimulate your endocannabinoid system and to lower the stress hormone cortisol. Choline is an essential nutrient that was discovered in 1998. Your body makes a small amount of choline, but you still need to eat it through your diet. Otherwise, you can develop a deficiency, and many people do. Most people don't meet their recommended daily intake for choline because very few foods in the Western diet contain it. And researchers have found adults with low levels of choline are more likely to have anxiety. Animal studies have also shown choline supplementation during pregnancy can prevent or dramatically reduce the chance of the offspring developing anxiety disorders. The best food source of choline includes grass-fed beef liver and egg yolks. But taking a high-quality choline supplement can have a more noticeable and immediate effect on your stress levels, especially for users of racetams. They need to either take CDP choline or alpha-GPC, or else eat up to 8 egg yolks per day to maintain the extra choline levels that are required for the enhanced brain function. Choline can reduce racing thoughts when you're stressed or anxious. It can also promote the regeneration of the myelin, and it works synergistically with omega-3 fish oils and uridine monophosphate to increase the growth of brain cells and to balance mood and help conditions like bipolar and anxiety. Selenium is an essential trace mineral, and it's important for many bodily processes that affect your brain function and your mental health. Research shows being low or deficient in selenium is associated with a significantly greater incidence of anxiety, and selenium supplements diminish the anxiety. Brazil nuts are the best source of selenium. A selenium deficiency can increase anxiety and make you more anxious. In one study, researchers found individuals with the lowest levels of selenium reported having increased anxiety. But after 5 weeks of supplementation with selenium, their anxiety decreased. Another study found selenium supplementation reduced anxiety in HIV drug users. It also helped to block the entry of the viral particles into the cells. A typical dose is 200 micrograms per day. Iron is a trace mineral and it's found in every living cell in the body. It carries oxygen to all parts of the body, and low levels can leave you feeling tired, pale, and irritable. Research also shows iron is an important cofactor in the synthesis of serotonin, and an iron deficiency can increase your risk of developing an anxiety disorder. In fact, iron levels are significantly lower in individuals with panic disorder. Spirulina is an excellent source of iron. Other studies have found iron deficient individuals have increased anxiety and increased fearfulness. Animal research also supports the idea that an iron deficiency increases anxiety, and normalizing the iron levels can reverse the anxiety-like behavior. Research suggests too much iron can cause health problems and actually increase anxiety. It's definitely a much better idea to get your iron from food sources like spirulina, meat and spinach. Beef liver is one of the best sources of iron. Some other good sources of iron include dark chocolate, sardines, pistachios and raisins. Vitamin C helps with iron's absorption. Vitamin D is a fat-soluble vitamin, but it's actually more accurate to describe it as a hormone because your skin synthesizes it when it's exposed to sunlight. Every tissue in your body has vitamin D receptors, including the brain. Developing a vitamin D deficiency can lead to a number of costly physiological and psychological problems, including anxiety, and this is backed up by research. The researchers have discovered significantly lower levels of vitamin D in individuals with anxiety. 2 studies found fibromyalgia patients and pregnant women with vitamin D deficiency had higher levels of anxiety. Unfortunately, reports indicate vitamin D deficiency is very common and a major problem across the globe. Researchers estimate 50% of the general population are at risk of a vitamin D deficiency. It's best to get your vitamin D by going outside and getting sunlight. But some people can't get enough sun, especially during the winter months. That's why it's recommended you take a vitamin D supplement. It's important to test and monitor your vitamin D levels before and after supplementation. Increasing your vitamin D levels can also help with depression, addiction and withdrawal. Some nutrients have antioxidant effects in the body, and being deficient in them can increase your anxiety. One study found people with generalized anxiety disorder had significantly lower levels of vitamin A beta-carotene, vitamin C and vitamin E, all of which have antioxidant properties. But after 6 weeks of supplementing with these antioxidant vitamins, the researchers observed a significant increase in the blood levels of the patients, and the anxious patients experienced a significant reduction in their anxiety. Researchers have also found taking both vitamin C and vitamin E together reduces anxiety, and several other studies show high doses of vitamin C decrease anxiety. In addition to getting vitamin C from fruits and vegetables, you should take 500 milligrams of vitamin C every day. Good food sources of vitamin E include almonds, spinach, sweet potatoes, avocados, olive oil, sunflower seeds, and butternut squash. For vitamin A, it's typically not recommended supplementing with it. Instead, you should get enough from food, like grass-fed beef liver, pastured egg yolks, grass-fed butter and ghee, carrots, sweet potatoes, kale, spinach, and broccoli. Cod liver oil is also a good food source of vitamin A. It also has vitamin D. Antioxidants also reduce cortisol, the body's main stress hormone. The mainstream approach to treating anxiety is through talk therapy and medication, but you can't treat a nutrient deficiency with counselling or prescriptions. It's important to note taking all the above nutrients in combination can provide a great relief from anxiety. Together, they have a synergistic effect. For example, numerous researchers have found taking vitamin B6 and magnesium together is more likely to reduce your anxiety than simply taking a magnesium supplement by itself. At this point, you might be thinking you could just take a multivitamin, and that would cover all your bases, but they usually don't contain enough of the important ingredients. They're beneficial especially if they contain the bioavailable forms of ingredients, like metal B12 and activated folate, but you still need to take extra B vitamins and magnesium, for example, to get the required dose. Overall, if you have anxiety, it would be recommended you eat lots of whole foods, have zinc and vitamin B6 supplements, krill oil, vitamin D, vitamin C, beef liver capsules, and a multivitamin. You can check out my website for more videos on mental health, such as the benefits of N-acetylcysteine or of lavender oil, of uridine monophosphate, picamilin, L-theanine, microdosing lithium orotate, and many others for natural anxiety treatment options. To book a consultation or learn about herbs, supplements, and natural treatments, check out my website.